Thank you so much for all of your comments. I mean, there have been so many of them, and many people having very differing views about, how they see it. But I think what was important was to listen to her, to put her in the seat, and to tell us what she's planning on doing. There'll be many, many more opportunities, but I think it's important to get to know somebody's mind. And she wants to come in and take that position, and it's a monster position. It really is. There's no getting away from it. And to get an outline as to how she's going to do it, well, let's see. Let's see how it all goes. All right, let's talk about something different now. Over 30 people are confirmed to have died from the latest Ebola virus outbreak. That's in the Democratic Republic of Congo, since the viral disease was detected 2 weeks ago. The World Health Organization's Regional Office for Africa says that of the 48 identified cases, 55% were women. To give us an update on this Ebola virus and the outbreak currently in the DRC, we are joined by Dr. Patrick Otim, who is the Program Area Manager for Emergency Response at the World Health Organization for Africa region. Dr. Otim, thank you very, very much for being with us and for your time.
Good morning, and it's always a pleasure to speak to you.
Thank you. Now, I mean, just looking at the latest figures as of last week, the date 17th of September, 31 people were confirmed to have died with the Ebola viral disease outbreak in some parts of the DRC. Have there been any changes to the figure?
Yes, unfortunately, the outbreak continues to evolve. As you know, today is the 17th day since the outbreak was confirmed. In the last 24 hours, we had 2 new confirmed cases. So it brings the number of confirmed cases to 43. And then we've had 10 probable cases. That means the cases that died before a laboratory test was done, but they have been linked to confirmed cases. So if you put all the 2 together, we have 53 so far. And unfortunately, out of those, then we have 25 among the confirmed cases that have died. So you add the 10 who died before test, that is 35 people that have died. It's at the moment, the outbreak is still confined to the Bulape health zone. There are really 6 health areas within Bulape that are affected, and the focus of the response has been to try to keep it within that health zone so that we can try to interrupt the transmission quite quickly.
Goodness me, that number is really jumping up, and certainly we'll update the figures on our side. I mean, I think we still have a lower figure that we're reporting on, but I mean, this is really it's escalated over these last few days. And also, if we may look at the strain, how different is it from previous ones? And is there a vaccine available to protect communities from this infection?
So the Ebola strain that we are dealing with is what we call the Ebola Zaire species. Now, it is the same species that has caused multiple outbreaks in DRC. So there have been 16 of these outbreaks. This is the 16th one. Now, if you compare to the last outbreak that occurred in that same province of Kasai in 2007, 2008, and 9, it's not very closely related to the current virus, but the current virus has been sequenced and it has very close phenotypic relationship with the virus that was first identified in 1976. So what it shows is that we had a new zoonotic spillover. So it's not related to the last outbreak, but it is the same species of the virus, and there has not been much change. Now, good enough for the Ebola Zaire species, we have actually 2 vaccines that have been pre-qualified by WHO. One is recommended for emergency response, which is the one that we are using now, the Ervebo vaccine that is made by Merck. And we have already vaccinated up to yesterday 1,500 contacts and their contacts, as well as the frontline health workers. We have on the ground now in Bulape up to 4,000 doses, and we are trying to ramp up the vaccination so that every new case that is identified, we do ring vaccination around it. All the contacts are listed and their contacts are listed, and then they are vaccinated quite quickly. So that is one of the major advantage that we have with this particular species of the Ebola virus, because we have an approved vaccine. We also have approved therapeutics that are used for managing severe cases.
Now, let's talk about how it actually affects people, the symptoms that one should look out for. And, the fact also that 55% of the cases, and again, I know the figures have changed, but it seems like a very high percentage of the cases are women. Perhaps you want to focus on those 2 issues.
Yes, so as we know, Ebola is a viral hemorrhagic fever. It really starts with a sudden onset of high-grade fever. So one of the common symptoms is a sudden onset of high-grade fever, usually up to 38 degrees Celsius. Then the person develops severe weakness, they have muscle pain, they have joint pain, they have sore throat, and that lasts usually for the first 3 to 5 days. And then they develop what we call the wet symptoms. So there is diarrhea, there is vomiting, and there's abdominal pain. So from that stage, because of the severe diarrhea that they usually have, the advanced form of the disease now can manifest in terms of multiple organ failure. So we have had a number of patients that have died in this outbreak because of the multiple organ failure. Some people do progress now to develop bleeding manifestations. So they start bleeding from all the openings in the body, so from the nose, the mouth, the ear, and the anus. So it's when you are in that very advanced stage, it's usually one of the critical phases, and it's very challenging to bring people back. I must also hasten to add that early start of treatment is very, very critical. At that phase, when you have fever, extreme weakness, it really helps the body to be able to fight off the infection. And when we administer the therapeutics that we have now, it really helps to slow down and increase the chances of recovery. Now, what we have seen is and it's not unusual like in this outbreak, we have seen in previous outbreaks, when someone is sick in the house, the people who care for this person, who, when they are vomiting, who clean, who, when they have soiled their beddings, who change the beddings are the women. So we see always in this kind of outbreaks that we have more cases amongst women than men. So we have seen now women accounting for 55% of the cases and up to 67% of the deaths, which is very, very unfortunate. And why we are really that we are identifying cases very early and take them into isolation so that they don't infect the other people in the house, so that the family don't have to take care of them in the house and then it's
Dr. Otim, thank you. Thank you so much for, I know it was a quick update on it, but it certainly has given us better insight into it and the severity of the situation. Dr. Patrick Otim is the Program Area Manager for Emergency Response of the World Health Organization African region, giving us an update on this Ebola virus outbreak in the DRC that we've heard has claimed in excess now of almost 60 lives. So we definitely are watching this one very closely.